You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
In many of the trigger sites where the headaches are originating from, the nerves are irritated by the vessels that ordinarily run side by side. Sometimes the vessel crosses the nerve or the nerve crosses the vessel. And in those situations, if the patient has tendency to migraine headaches, is going to have migraine headaches. And the reality is that on patients do not have tendency to have migraine headaches, those nerves and vessels cross each other, but they never cause problems or irritate the nerve. Vessel doesn't irritate the nerve. And we have actually demonstrated scientifically that the vessels are the major factor. And we have also demonstrated scientifically that patients who have migraine headaches are missing a membrane that is called myelin, which is an insulation around the nerve that is damaged genetically. That damage can also be related to an injury, like a whiplash injury. And when the myelin is damaged, pulsation of the vessel that doesn't ordinarily irritate the nerve becomes a problem, and it irritates the nerve. And we have, again, demonstrated by removing those vessels, we can actually stop the headaches. And that is actually not only, we have demonstrated on the face and periphery, there's a neurosurgery procedure to separate the vessel from the nerve that is called the trigeminal nerve inside the head, under the brain, to get rid of another version of a facial pain that is a severe facial pain, and it's called neuralgia. And it involves all of the branches of the facial nerve. And the neurosurgeons do the same thing. They separate them. They put an insulation in between the nerve and the vessel so that the pulsation of the vessel doesn't irritate the nerve. So that's a phenomenon that is known, but we have demonstrated again that scientifically. But the main cause of the migraine headaches in most incidences is genetic disposition. An overwhelming majority of our patients on whom I have operated on have family history of migraine headaches. But as I mentioned earlier, the injury that is going to cause a trauma to the myelin or damage the myelin can also cause headaches like migraine headaches. So that would be obviously the origin of the migraine headaches. Now, the factors, the triggers of migraine headaches, as I mentioned, one is the vessel that we talked about, but one is the contact that I mentioned inside the nose. The other one that is a major factor in some sites, like in the back of the head, center back of the head, or in above the eyebrow, the muscles that we use for frowning can cause headaches. In fact, that's how I discovered that surgery works for migraine headaches, because we were removing the frowning muscle to improve the appearance of the forehead. And those patients told us that they no longer have migraine headaches. And this similar experience came across with the Botox. What Botox does paralyzes the muscles. Although Botox also has some benefits in terms of reducing the inflammation, which reduces the headaches, but may not take it away completely the way surgery does. When the surgery works, headaches go away completely.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.